Hi, good afternoon everyone. Thank you so much for joining us today at Oraliah. Today we'll be talking all about teeth whitening. I'm Dr. Pooja from Oraliah Dental Clinics, Bangalore. So today we'll be talking and discussing about what is teeth whitening and why and when is teeth whitening done, and the types of teeth whitening, what are the different adverse effects of teeth whitening, and what are the measures to be taken once the teeth whitening treatment is completed from your end. Right, so let's get started with what is teeth whitening and things to know about teeth whitening. Now, what is teeth whitening? The name itself says it is a very simple procedure, 100% safe to undertake. It is a simple, very effective procedure that is done to remove the stainings and discoloration from the tooth surface. Right? Various staining agents, bleaching agents that are used in the procedure with a different amount of concentrations in it. Right, so it is more of a cosmetic dental procedure than the essential dental services. Right, people here often come to us giving wanting us to change the shades of the teeth a little. They might feel it's a bit yellow in color, or brownish discoloration that can be seen in the teeth structure. Right, so now why and when is teeth whitening done? So that is an important question, why you should be doing teeth whitening. Now, it is mainly done for one of the important reasons, that is staining or discoloration. Now, I'll quickly brief you through what is staining, different types of staining. Now, there are two types of staining, intrinsic staining and extrinsic staining. Right, so intrinsic staining is the type of staining that occurs within the tooth, that is from inside of the tooth. Right, that could be due to fluorosis, or could be any other staining agents, or it could be due to tooth decay, or it could be due to RCT treated teeth that undergo discoloration over a period of time, that the tooth that is dead from the inside. So this is intrinsic staining. This can be treated by placing a bleaching agent inside the tooth, that is in the pulp chamber. That is inside the pulp chamber, that gives an appearance of slightly brighter than what it appears to be now. Right, this is intrinsic staining. Now coming to the extrinsic staining, this is the part where we concentrate on today, that is extrinsic staining and how to manage them. Extrinsic staining occurs from the chromogenic agents that appears in the food substance that you take, like caffeine intake, or it could be coffee, tea, or red wine, or some sauces that you use on a daily basis, that leaves behind the staining on the surfaces of the tooth. The tooth absorbs the coloring agent that is there in the food substance on the surface, and it leaves behind yellowish to brownish discoloration on the teeth surface. So mostly people are concerned about this. So this is extrinsic staining. So how to address this is teeth whitening. So patients walk into our clinic to get their teeth whitening done. Two types of teeth whitening that we do, right? So one is in-house teeth whitening, and the other one is home teeth whitening. So we offer patients both the options, and depending on their comfortability or convenience, they choose to go further with any one of these treatments. Right, so in-house teeth whitening, what we do is a very simple procedure. It usually takes one settings or two settings maximum, depending on the patient's convenience. Right, so when patient walks in, we do a thorough evaluation and checkup, and once that's done, we place gingival protecting agent, right, that is gum protecting agent. and then we go on about placing this chemical called carbamide peroxide, that is a bleaching agent, that is the teeth whitening agent, on the surface of the teeth, and leave it for some few minutes and then rinse it off. So this is, once this is done, we send the patient back home, and then that's it. That is what we do in in-house in-office teeth whitening. This is what we do. Now coming to the home bleaching, when the patient prefers home bleaching, they have enough time in their day, they want to spend their time in beautifying their smile or teeth, they want to they can ask for bleaching kit. So what we do is, again, the patient walks in and we take the measurement of the teeth, right, and then we fabricate a customized tray for the patient, and then along with that we dispense carbamide peroxide gel, right. So what you as a patient has to do is go back home and place that carbamide peroxide gel on the tray and place it on your teeth for several hours in a day, and this has to be done every day without fail, and this has to be done for at least about 2 to 3 weeks, and then come in for a follow-up. So this is home bleaching and in-house bleaching. In in-house bleaching, the results is usually shown after 8 to 10 days after the treatment is done. It will be 3 to 6 shades brighter than what it was when you walked in. Then in home bleaching, you might start seeing results after 3 to 4 weeks once you start using it regularly, following all the instruction given by your dentist, right? So this is a procedure that is completely safe, 100% safe, and you don't have to worry about your teeth getting damaged. That is all the myths that are there about teeth whitening. It's completely safe. And now these are the types of teeth whitening that we offer to the patients in a clinic. And now coming to the adverse effects, that are side effects of teeth whitening, right? So teeth whitening side effects, one is sensitivity, and the other one is gum irritation, or swollen gums, or irritation of the gums. So these are the only two side effects that can be seen. Sensitivity occurs because your tooth structure, once the bleaching agent, that is carbamide peroxide, once it is placed, it absorbs the agent, right? It becomes a little porous, it becomes a little dehydrated. So you might feel sensitive for the first 2 days initially, but that is completely normal, nothing to be worried about. It is only temporary. Once that is done, you, after like 2 to 3 days, it should subside on its own. There is nothing to be worried about that sensitivity. It is only temporary. And the other one is gingival irritation. Gingival irritation usually occurs when the carbamide peroxide gel that we use is overexposed to the tooth structure and it is in your mouth for a longer duration than it is recommended. That's when gingival irritation might occur, which is also common, but it is completely okay, or it is safe. It will definitely subside after a couple of hours, or it will take some couple of days. It should be fine after that. So these are the adverse effects of teeth whitening. Then coming to the maintenance after you get your teeth whitening done, how do you maintain this, right? So one is you need to come for follow-up visits every 6 months once at least, to get your cleaning done or checkup done, general checkup done. So we will check and evaluate what's happening. If the staining is continuous or it's still happening, you might have to cut down few or bring down the use of few chromogenic foods, that is coffee intake that you take every day. All this has to be maintained after the teeth bleaching is done. So regular dental checkup is absolutely necessary after teeth bleaching is done, teeth whitening is done. After this, you can get your teeth whitening done every once in a while, but not too very often. We wouldn't recommend that. So yeah, that's it about teeth whitening. If you have any questions or queries regarding teeth whitening, please let me know. I'll try to answer them. Renu Tyagi, hello doctor, I want to ask something. Will my teeth get sensitive after whitening? Yeah, just like I told you just now, there is high chances that your teeth might get sensitive, and it's because your teeth is a little dehydrated because of the agent that we use, right? It might not adapt to the change of temperature well. When you drink hot or cold, you might feel a little bit of sensitivity. That is only temporary. I'm mentioning it again. So it's only temporary, and it should be fine after a couple of days. Give it a couple of days and it should be fine. Hi, I wanted to do teeth whitening, but my dentist told not to do it as I have some tooth decay. Can you inform me when we cannot get tooth whitening? Okay, so tooth decay is another type of condition where the type of bleaching that I just talked about will not be affected, because that is a form of intrinsic staining. The tooth decay happens from within the tooth, right? So the bacteria cause the tooth decay, and the color might be brownish to grayish in color. So for that, if the tooth decay is too much, you cannot do much about it. You cannot go for tooth whitening with that. You might have to go for root canal if it is restorable. If the tooth structure is sufficient, you can go for root canal, or if there are only root stumps, you might have to go for extraction. Bleaching is not recommended, or it's not an option for tooth decay if it's beyond the state to save the tooth. Any other questions? So that's it for today's session, I think. Yeah, and you can always, if you have any more queries regarding teeth whitening or any other treatments, you can always visit us on our website oraliah.com, dental.com, or you can always give us a call or WhatsApp message to reach out to us. Feel free to do that. We'll always be available for your guidance. So that's it for today's session. Thank you so much.